Interventions with a King. Discussion and commentary based on articles from JACC Cardiovascular Interventions.
I'm Spencer King, editor of JACC Intervention, and I'm visiting today with Dr. Thierry Lefevre from Institut Cardiovascular, Paris Sud.
Yes.
And we welcome you very much. You have a wonderful paper in JACC Interventions dealing with a very current and important topic. It's got to do with the transfemoral approach to TAVI, to transcutaneous aortic valve implantation. And we are learning, particularly right now, since we've heard the results of the partner trial, that vascular complications are some of the more serious complications. And you have developed a new criteria to predict vascular complications. Tell us about that and how that may be beneficial as we go forward in this exciting new technology.
Yeah, thank you very much, Spencer. So it's, as we learned today and in past the Cohort B of partner, access site complication is really an issue when doing TAVI. We learned in our previous experience that having vascular complication increase death rate at 30 days, and it multiplied by 3 in our experience the risk of death.
3 times more mortality if you have vascular complication compared to not having. Okay.
Exactly. So we decide to look in our early experience at the predictors of vascular complications. So we look at the first 129 patients that we have done transfemorally with the core valve and Edwards, using 18, 19, 22, and 24 French. And finally, we found only 3 predictors. The first one was the ratio between the sheath size, the outer diameter of the sheath, and the femoral artery. The second one was the experience of the team. And the third one was the presence of calcification in the femoral arteries.
So the risk, you had the opportunity to use many different sizes and both types of aortic valves, and independent of that, you could correlate the sheath size very, very well with artery and as an important ingredient, and calcification. And what about tortuosity? Is that very important?
Yeah, so it's an important parameter, but we didn't find as an independent predictor. What is interesting is that the sheath size by itself was not a predictor, but only the ratio between the sheath size and the femoral size. And the cutoff point was a ratio of 1.05 with a good predictive value.
So how do you use this information to improve the outcomes?
So today we use this SFAR ratio to decide which approach we will select. If we have no calcification, the ratio can be 1.1. If there is calcification, it should be 1.0. And we decide the approach, so transapical or transfemoral or transaortic or subclavian, according to the SFAR ratio that we found.
So in the trial that was just done, the approaches were transfemoral or transapical, but you've added in now also going the subclavian route, and you tell me a sternal small incision.
Yeah, exactly.
Well, these are going to be exciting new advances and should provide a safer way to do TAVI. We're very excited about the results of the partner trials and the core valve trials coming around in this country, and your experience is going to be put to work. Hopefully we'll have less vascular complications in the future. Thank you very much for visiting with us.
Thank you very much.